Good afternoon. Buenas tardes y bienvenidos. My name is Steve Hernandez, and I am the Executive Director of the Legislature's Nonpartisan Commission on Women, Children, Seniors, Equity, and Opportunity. We are here today hosting the Latino and Puerto Rican Affairs Subcommission of the Commission to conduct a COVID-19 impact on the Connecticut Latino community listening session. I'm especially honored today because I am joined by luminaries and emerging leaders of the Latino community in Connecticut. And I'm really excited to be led today in conversation by our subcommission co-chair, Leticia Colon de Mejias. Leticia, I know that you will be introducing our panelists throughout the evening, and I'm just really excited to get the conversation started. So welcome, Leticia.
Thank you. I'm extremely excited. This is a great lineup of Latino leaders, and it's a really good conversation that we should have tonight. First, I want to start by sharing my screen and taking an opportunity to share a presentation with you. But I'd like to acknowledge the other sub-commissioners that are on the call from Latino and Puerto Rican Affairs, and that is Gladys Rivera and Hilda Nieves. You guys just want to wave so people know who you are. Thank you so much. Now I'd like to share my screen with you moving forward. Okay, hopefully everyone can see this. So we took the time to outline our top priorities for the upcoming session. And before that, we're just going to review a little bit of data on the statistics and information on Latinos in Connecticut. Maybe. Aha. Sorry, my computer decided to have a technical difficulty. Worked fine in the testing run always. That always works that way. All right. So this will be provided also afterwards on our website for the Commission on Women, Children, Seniors, Equity, and Opportunity. So we have our commissioners listed here, Gladys, Hilda, Luis Valdez, and myself. And also the staff are Stephen Hernandez and Werner Ondell. In Connecticut, Latino affairs obviously are very important to us, but also it's important to the state's economic development as well. And so we put together some population by race numbers that I'm not going to take the time to get into because we have lots of great people to talk. So I'll just do a general overview. Right now, Connecticut boasts around 16.9% Latino population. These are our last statistics that we had, but we do have a census that is done and it will be coming out soon, the 2020 census, which is exciting. And so these are the projections at the time. In Connecticut, the data on Latinos is very rich, and we are a very large part of both the workforce and also in economic affairs. The labor market areas that are listed here show that Connecticut actually closely models after the United States. So much of the numbers that we see here in Connecticut are reflected nationally when it comes to Latino populations. So how has the coronavirus impacted our community? We have had a very hard downturn hitting Latinos. In fact, the United States during this went from a 4.8% unemployment rate to an 18.5% unemployment rate. And in June, it was at 14.5%. We're continuing to see impacts, of course, which is why we're holding this conversation to hear from the leaders and hear what's happening in their communities that they're serving. This exceeds the levels from the Great Recession, which is very hard to believe, but it's happening right now, and we're all seeing those impacts. Hispanic women have experienced especially steep rise in unemployment rates, which jumped from 5.5% to 20.5%. This is in comparison to the unemployment overall for Hispanic men, which was only at 16.9%. In June, the unemployment rate of US Hispanics was 15.3%, and this is higher than most foreign-born Hispanics. So the COVID effect in Connecticut has continued to rise. And if we look here at the cases per 100,000 by race and ethnicity, we're seeing here that neck and neck, Hispanics and Blacks have really been impacted greatly by this virus. And then below that, we have the deaths per 100,000 by ethnicity. And again, we're seeing that the Hispanic population has been impacted. So based on all of this, we had some priorities in mind, but then COVID hit. And so we kind of reassessed all of the things that we had been discussing as a subcommission. And we came up with 3 critical areas of focus. So employment, food, and shelter during this insecurity as a result of COVID obviously is a real issue. Support for minority and Latino businesses and workforce development underneath that is obviously very critical as well in relationship to the COVID crisis. But overall, we're seeing that these were longstanding issues in our populations. And environmental education and energy efficiency and energy justice has actually become a large issue, with over 400,000 people in Connecticut being unable to afford their housing and energy bills. So the current pandemic has shed light on many basic needs have become increasingly more pressing and less stable. These are things that were already a problem, and the pandemic really just kind of said, oh, here's the light, guys. Let's zoom in on these issues of concern. Situation has shed additional information on the longstanding socioeconomic disparities, which are often, unfortunately, connected to lack of wealth, lack of political representation, lack of access to high quality education, and lack of access to workforce development and good paying jobs, which is what would keep our communities stable. These are basic needs, and therefore the state and our groups must plan to meet these basic needs. The pandemic hit minority businesses hard, leaving many small minority businesses with a lack of support. We're seeing record high unemployment rates and business closures. This is specifically really hitting Latino businesses because of the type of businesses that we run in our state. So what can we do then to ensure minorities are informed on how to start and keep businesses running? And how can we better connect our communities and help them access grants, low interest loans, and other supports in their communities, which might heighten economic development? How can we use small business to lift our communities of color and increase the rate of minority socioeconomic success in our state overall? And these are the questions that we pose to the leaders here and to the leaders in our state. So strains on the global environment continue to rise, impacting our communities' health and stability. But we feel that in order for our communities to have meaningful interaction and to engage in planning processes, that they need access to the right type of education that's understandable and accessible and empowers them to make choices, and things such as planning for their futures, planning for their energy choices. And this would include information on where energy comes from and how these issues impact both our environment, our health, and our economy. This education should also connect workforce opportunities, because we have found in our studies and information provided to us that there is a $5,000 to $7,000 funding gap per student in areas where there's a more than 50% representation of minorities at the school level. We find that this shift to online learning has also heightened the problems with learning in communities of color and has demonstrated a lack of access to educational tools for at-home learning, such as lack of stable online internet or tools to study with. It's critical that our communities have access to science-based education and energy education to help them plan on their own successful futures and give them a voice at the table. So with that, I would like to acknowledge that I'm going to stop sharing my screen. And I would also like to acknowledge that we did have Alan Tan, the chair for the Commission on Women, Children, Seniors, Equity, and Opportunity, join us here this evening. So Alan, thank you for joining us. So without wasting any more of our time, I will actually be calling on Ingrid. If you're ready to share your screen, Ingrid. So Ingrid Alvarez actually is a member of the Hispanic Federation for the New England region, and she's the director there, and she will be providing a short presentation on the COVID impacts in our communities. Ingrid?
Yes, so good evening, commissioners, Executive Director Hernandez, fellow colleagues and guests. Thank you for the invitation this evening. Warner, if we can start on the page 3, which is the third slide on the presentation. In response to the devastating effects of the coronavirus pandemic on the Latino community, Hispanic Federation has conducted an impact study to identify and devise a strategy to overcome COVID-19 barriers that exist for Latinos. Specifically, the impact study covered the following regions: the state of Florida, Illinois, Puerto Rico, the state of Connecticut, New Jersey, New York, and the surrounding tri-state area. Our collective goal was to gather comprehensive data in real time that would enable us, our community organizations, philanthropists, and policymakers, develop, expand, and fund programs that serve the needs of Latino communities with a focus on work, food, and shelter. A little bit of the context for how the surveys were designed, co-created, and deployed. In late September, Hispanic Federation conducted community surveys to capture the experience of Latinos across the aforementioned states. The surveys were completed by nearly 3,000 community members, including 1,936 in Spanish and 970 in English. The survey was disseminated in English and Spanish across the 6 states regions. Again, New York, New Jersey, Connecticut, Florida, Illinois, and Puerto Rico. In addition to disseminating the survey among Hispanic Federation's network of advocates, member agencies, and partners, the survey was also promoted through targeted social media ads, and participants also had the chance to enter a drawing for a $250 gift card. So I wanted to share the context. On the national level, the survey produced that 85% of Spanish language survey takers identified as women. Overall, 79.5% of all survey takers were women. Nearly 70% of all survey takers identified as head of households. And nearly 1/4 of Spanish language survey takers reported making less than $44,999 a year. Overall, nearly 60% of all survey takers make less than this amount. Some of the survey top line findings was that under the category of employment, 75.9% identified as employed, self-employed, or a business owner pre-pandemic. Nearly 80% of Spanish language survey takers reported a reduced income. Overall, 70% of all respondents reported losing income and 50% lost their job. Over 1/4 of the participants identified as essential worker or as an essential worker, with positions ranging from factory workers, supermarket cashiers, food service, farm workers, nurses, and law enforcement. 87.3% of Spanish language survey takers reported using savings to cover basic costs versus 65.2% of English language. Overall, 76% of all respondents had to use savings. 32%, nearly 1/3 of the respondents have not been able to pay their rent or mortgage. A total of 43% among Spanish language versus 20.63% of the English speaking respondents. I wanted to provide the national survey top line findings to make the comparison and share the data specifically for the state of Connecticut. And so 94% of Spanish language survey takers identified as women in Connecticut. Overall, 85% of all survey takers identified as women. 76% of Spanish language survey takers identified as head of household. Overall, 72% of all survey takers identify as such. Nearly 83% of Spanish language survey takers in Connecticut reported making less than the $44,999 a year. And overall, 68% of all survey takers in Connecticut make less than this amount. 77% of Connecticut respondents identified as employed, self-employed, or a business owner pre-pandemic. Nearly 72% of Spanish language survey takers from Connecticut reported a reduced income. Overall, 66% of all respondents reported losing income, and 46% lost their job in Connecticut. Over 40% of the English language survey takers in the state of Connecticut identified as an essential worker. compared to 32% of the overall survey takers in the states that we conducted the survey in. Positions range from restaurant workers to social workers, community health organizers, and medical assistants. 91.6% of Spanish language survey takers in Connecticut reporting using savings to cover basic costs versus 78% of the English language survey takers. Overall, 85% of all respondents in Connecticut had to use savings at a higher rate compared to all the other states, which came at a collective average of 76%. Over 41% of Spanish language respondents in Connecticut have not been able to pay their rent or mortgage, compared to 32% of the national survey takers. This slide depicts that in Connecticut, we put out a call to community leaders, government leaders, community members, in joining a series of Connecticut focus groups. And the framework for the focus groups was round one, which was a discussion of organizational best practices regarding food and shelter supports and program recommendations for recovery. Round two, and my slide is covered by the participants, but I'll read it from my document. Round two covered a discussion of organization best practices regarding employment and small business supports and program recommendations for recovery. Round four covered a recap of all programmatic and policy recommendations and next steps from the leaders who participated. And I'm sorry, I skipped round three. Round three, discussion and organization recommendations on systemic changes and policy solutions, followed by a recap of the collective focus groups, programmatic and policy recommendations, and next steps. So I will stop there. Thank you for allowing me to present the data. The focus groups happen as early as November 10th. So this is happening in real time. We're eager to share this with all of our regions and the broader community. And I look forward to any questions and the dialogue to ensue.
So thank you, Ingrid. I appreciate your presentation. We did just actually have Deputy Speaker Juan Candelaria. I don't know why I cannot say that name. I've said it 1,000 times. I apologize. Candelaria, who's the 95th District Representative for New Haven, just joined. Juan.
Hello, ¿cómo está?
Thank you for joining us. And I know that you do have to get off this evening a little earlier. So I wanted to have you take the opportunity to speak and answer some questions. And then I'm going to circle back to you, Ingrid, because that was an incredible presentation. And I know I have some questions and I'm sure others do as well. Juan, if you would like to speak now, that would be lovely.
Sure. Thank you for the opportunity to join you in this meeting today. As many of you know, that we've seen an uptick in coronavirus in the state of Connecticut, over 107,000 cases, and now we're seeing the majority of the concentration in the urban cities. New Haven, for example, being one of them. It is a little bit concerning because we're seeing these rates, specifically when we look at the minority population, we see a high number when it comes to Latinos, and that's very concerning. I'll tell you a little bit about my district. In my district, we have a hotspot, which is Fairhaven community, and the largest concentration are Latinos. Our major concern is ensuring that our community is educated and to have the proper PPE, right? The masks, that they're following social distancing, and they're limiting their gatherings. We as Latinos know that we love family, right? We have large families and we like to gather together, and that will be a challenge coming Thanksgiving. So it is, how do we maintain within those guidelines, but also ensure that our community is educated? And I don't think that we're actually providing to the Latino community the necessary resources. When it comes to the testing, many of them don't have the resources to get tested. They don't know that the tests are for free. One of the impact that has happened to our community is that many of them have lost their jobs. Many of them are unemployed, collecting unemployment. That's actually running out, and that's a concern. That's a concern because many of them are dipping into their savings to pay for their household necessities. And that's alarming. Unless we at the state level come up with some additional resources for the families, we're going to see a large impact in the Latino community specifically. One of the other things that we've seen a lot is that many of the Latinos in the pandemic started, they have not been able to pay their rents. And that's a challenge. I've been getting a lot of calls from constituents saying, I don't know what to do. The landlord is putting pressure on me. I know that we have an exemption, but that exemption is going to run out at a certain period of time. What are we going to do after that? And there's no answers to that, right? We have, through the Department of Housing, there's some resources available to help not only landlords pay their mortgage, but also homeowners assist them with their rent. But those resources are very limited. So it's basically on a first come, first served basis. Those are the things that are currently happening right now. But what we need to do is, how do we go back to the community, re-educate them about protection, wearing the mask accordingly, and also work together to identify resources. There's another segment of our community, which is the immigrant population. That population has been impacted the worst, right? Because many of them were the ones that are working in the restaurant industry. Many of these restaurants have closed their doors, or they limited the number of hours, so they're not getting the right resources. But these individuals do not have what other Latino who are U.S. citizens have. They don't have the ability to apply for these resources, and they're constrained to really depend on each other, on other family members that may have limited resources as well. So one of the things I think that is critical for us to do is, moving forward, is how do we educate the community, but also identify resources to help them get through this pandemic.
Thank you. Does anyone have any questions for Representative Candelaria? Hilda or Gladys? Please feel free to unmute yourself. Hilda.
Yeah, I do have a question. If the representative would have any insight, any numbers in terms of the actual population of those that are undocumented living in New Haven, what percentage of them are really impacted? If you know that the answer to that question.
We don't have actually that particular number for undocumented. One thing that I can actually tell you is that there is a statewide program that is giving primarily everyone can qualify, but the ones that we're seeing applying are the immigrant community, where they receive around $300 debit card so that they can use that debit card to buy groceries or other things, pay bills with those cards. And we've seen upwards in the thousands just for New Haven alone that have been applying for the cards.
Yeah,
but in general, when we look at the Latino population for the whole state of Connecticut, approximately we're seeing around 19,000 and change that have been impacted. So those are the cases for the Hispanic community. But it's very hard to segregate because we're not getting that actual data. So we're using those that apply for the debit card and New Haven as a tool, as an identifier for us to identify them and their families when it comes to their immigration status.
Okay. Thank you.
De nada.
Thank you, Hilda.
Buenas tardes, representante Candelaria. How are you?
Hola, ¿cómo usted está?
Todo bien, gracias a Dios. I do have a question. Do you have an action plan for? I know we have all these numbers and we have all these studies, but what is the action plan? What is our goal to be able to help these people that are in such need?
Mira, election plan is something I think that all of us will have to put together, to be honest with you. I don't think not one individual can put the action plan together, right? We have to use other resources available. Those including our nonprofit agencies that have resources. That includes the elected officials. That includes municipal leaders. We all have to come up with that strategy plan. And I think that we have to start gathering around the state, and that hasn't happened yet. I think individually, we're all doing something within our own communities to assist these families, but I don't think there's a statewide strategy for us to target this. I know that there has been movement within the immigrant community, right? Doing a little bit of rallies to ensure that there's some dollars allocated to help these families. And I think going into the legislative session, we have to take into consideration the impact that this has on the Latino community, specifically the immigrant community. And we have to allocate those resources from the state. And that's going to be the biggest challenge, understanding that we right now are facing a $4 billion deficit in the state of Connecticut. That's the biggest challenge that we have. But we need to identify, because we're talking about lives, we're talking about families, and we need to identify the dollars necessary. So I welcome basically from everyone in this panel and those who are listening, so that we can convene as one community and let's start strategizing before session starts. Because I know that other communities are currently doing that now. They're strategizing. We need to do it ourselves. So this sería the best response for you right now.
Gracias. Thank you so much.
You're welcome.
Thank you, Representative. And I know that you have to jump off this evening. Do we have any more questions for the Honorable Representative this evening? I have one quick question, because you mentioned the COVID testing and that people are being, unable to obtain COVID testing. I recently had someone contact me about being charged for the COVID testing at a clinic. And I wondered if there's any mechanisms that you're aware of that the state is using to track when uninsured people are being charged for the COVID tests that they should be getting for free.
Right. To my knowledge, unless it's self-reported, there is no way for the state to know that the individual has been charged. What I've noticed is that I work also for a clinic myself, and what's happening is behind the scenes, the way that when you get your COVID test and you get billed, it happens, you have to get billed automatically, but that billing should not go directly to the patient. And unfortunately, those bills are being sent to the patient. But in the meantime, by the time they get that bill, everything gets resolved in patient accounts behind the closed doors. So that gets resolved and the bill is actually paid. So if anyone that does get a bill, they can come forward to the Department of Health and make them known that this is happening, and they should be able to resolve that issue. No one should be charged for being tested. And I think that's the message that we have to deliver, that everybody should be tested as many times as they need to, and it's free of charge.
Thank you very much for that answer. I appreciate it. And thank you for joining us this evening.
No, thank you.
You're welcome to
I have a 6 o'clock Zoom meeting as well that I need to get on, but thank you so much. Gracias a todos por esta participación. Bye-bye.
Thank you very much. I would like to take the opportunity to circle back really quick to Ingrid, if possible, and see if there were any questions that the commissioners have for Ingrid as well, before I move on to Wildelise. You're up next, Wildelise, so. You can unmute yourself, Hilda. Go for it. You're on mute.
Okay. I just wanted to circle back to some of the information she was citing. And just what caught my attention was were the parallels in terms of what Ingrid was citing from her report and what they found in their studies and the surveys in different states that they forwarded the surveys to, in terms of the conversations that we actually had as a subcommission, talking about businesses being impacted, women, talking about issues of work and education. A lot of what Ingrid was citing in terms of the data that was collected seemed very much in parallel to what we were discussing a couple of weeks ago when we actually had our Zoom meeting and talked about what our priorities were going to be as a subcommission.
Thank you for that. If I could just, in response to that, right? So pre-COVID, or before this unprecedented pandemic, right? If it's, there's the saying, right? If it's not measured, it doesn't exist, right? In Connecticut, historically and nationally, ranks right up there as one of the most disparate states in our nation. And for us that live here and do this work, it's not new to us. It's part of what we chip away, and we try to each legislative session. But in addition to that, and compounded by the way this pandemic is ravaging our communities, there is a direct correlation. You know, one of the statistics that very clearly stuck out at me was the overrepresentation of female-headed households, Latino female-headed households. But it didn't surprise me because also in my civic engagement work around both getting out the count in census and registering voters and getting the vote out, right? When you talk about what the rising American electorate in Connecticut is, it's Black and white, Black and brown women in all regions of this state. And so across other equity indicators, it seems to align and be consistent. Thank you.
It seems to me that one of the things that the pandemic has revealed is the incredible need for elasticity within our communities, you know, diversifying the spaces in which we work, diversifying our sources of income, our professional access, and also our access to civic spaces. Because one thing that is so critically clear is that we are not receiving information as a community as effectively and efficiently as we should be. And there are myriad reasons for that, but we need to start addressing them, because our community, when pandemic hits, we get hit first, we get hit the hardest and the most sustainably. So a lot to think about with your data. Thank you, Ingrid.
Thank you so much. Next, we will hear from Wildelise Bermudez, City Councilwoman from Hartford. Wildelise, thank you for joining us.
Thank you so much for having me. Really wonderful opportunity, and thank you for hosting this. So I wanted to touch upon two main things that are impacting the Latino community. And I know that others have touched upon other items, but specifically wanted to highlight childcare and housing. And so I'll start with childcare and then move on to housing. So before the pandemic hit in the state of Connecticut, we were short 80,000 slots for childcare. So, and that's a rough estimate. Certainly the number was a little higher. And so that was pre-pandemic. Now, during this pandemic, it has certainly changed, and the number is even higher than that. So we have a problem where there's a big need for essential workers to be able to work and to be able to place their their kids in the care of others, whether that's through family centers, so centers specifically in someone's house by providers, childcare providers, or a regular standing center, like say a nonprofit agency or a for-profit agency. And so there has been a very big problem entering into this pandemic that childcare providers are facing, half of which in Connecticut are Latina women who provide childcare. And so when the pandemic hit immediately, a lot of centers had to close. We can see the case of New Haven, for instance, where by that municipality, they decided that everything would be shut down. Other municipalities they decided to play it by ear. And so some of these centers had to close during the pandemic. Others decided to close out of their own will, just trying to figure out and assess the situation. And now we have this limbo where, because there had been closings early on and then they reopen, you are at a shortfall. So if you are running this business and you're playing catch up, and at the same time, there are certain restrictions that are being placed because of the number of children that can be in your care, depending on how big your facility is or how small it is, then you are limited in terms of how much income, how much revenue you will be able to make. And so that really places a big disadvantage in the childcare industry as we know it. And it is a huge problem for the state of Connecticut and our families, because it creates an instability when we talk about our workforce. So, and I want to touch upon the workforce part. For example, there are municipalities, many municipalities throughout Connecticut have school readiness programs, which are excellent programs. And typically school readiness programs, as a parent, allow you the opportunity to, drop off your child, they get an excellent school readiness education while you're working. And then during this pandemic, we saw that a lot of those programs had to close, then they reopened. And so what happened was, for many parents, when they lost their job, they lost their placement in the school readiness program, because you have to be working, even though you can meet the income threshold, and if you don't make that much money. And so while you are looking for work as someone who lost your job, you don't have access, you no longer have access to the school readiness programs, even though you're actively looking for work. And so there's this imbalance that has been definitely exacerbated because of the pandemic. On top of that, and again, let's keep in mind that the half of the population that are childcare providers identify as Latina women. And so on top of that, you have a lot of, yes, funding that has come through at the federal level, then trickled down at the state level, so that businesses in Connecticut can either take out low interest loans, et cetera. We've seen all of the gamut of what's available. But for this specific sector, it's as if they had been treated very differently. And so we recognize that at the same moment, they did not get first dibs on loans. And bigger businesses, industries did. And so that placed them at an automatic disadvantage. So to summarize it, the reality that we're up against right now is that we are going to be seeing a dwindling industry within childcare, which will then severely impact our workforce in general. Because if you can't drop off your child at childcare, then where is your child going to go? Then you can't work. So that's for childcare. The second one being housing. At the local level, I'm a Hartford City Council person. And at the local level, immediately starting within the pandemic, we received calls. I received personal calls from residents in Hartford saying, look, my landlord is kicking me out right now. My stuff is being thrown on the street right now. And we had to explain to them, that they can't do that because there's a governor's executive order. And so even though we are currently still under the executive order, and we've kind of in this situation where it's been delayed, right? So folks don't have to pay yet, but it's going to be a catch up. And so one of the movements that a lot of advocates are saying is, can we really aggressively take a look at a true solution for our housing crisis that we are going to be encountering? I mean, we're already encountering it, but once evictions start and there's no longer a moratorium, we are going to be seeing like crazy amounts of people who are going to be on the streets, literally. And so that's the other piece of it. And for those who are watching this and are trying to figure out, well, what is available in terms of housing? So the state of Connecticut does have a program. It was funding that came through at the federal level, and it got to the state level through the CARES Act. And the funding was designated, and it's titled the Connecticut Temporary Housing Rental Assistance Program. Connecticut Temporary Housing Rental Assistance Program. And it's a program that's available for those individuals who've lost their jobs and were unable to qualify for unemployment, whereby they can qualify to receive up to $4,000 in back rent. And so that is a program that is available in other states. In our state, $10 million were set aside for that. You can imagine that that amount has gone very quickly. People can still call. The number is 1-860-785-3111. So you can certainly still call, be put on a waiting list. In other states, we saw that amount was higher. So the amount that was set aside was closer to 60 million, 70 million. So I think that overall there has to be a bigger push in that category. And there's certainly a lot that can be done at the state level as well as the municipal level on those two issues.
Thank you, Wildelise. That was extremely informative, and I could not write things down fast enough. Do any of the commissioners have questions for Wildelise?
Not a question, but as far as the childcare is concerned, it's kind of a catch-22, right? Because as people were losing their jobs and not sending their children to childcare, that created extra space and overages. So childcare systems were closing down also. We also have a shortage of teachers. They don't want to work. They're afraid to go to work. So, it's like, how do we balance this so that people that are working can have childcare and still the childcare agencies still be able to function?
Absolutely, there has to be a balance. And I think where we're at right now, the childcare providers that have remained open, they don't want to close down their businesses. They want to continue to be able to provide the services. And we really need to provide them with funding right now, emergency funding, so that they can have their doors open. Because if not, we are going to see literally half of our childcare centers close in the state of Connecticut.
Those are terrifying numbers, Wildelise. The other thing it brings to light too is that with the school issue is that some schools are doing virtual for children as young as 4 and 5 years old. And this is very similar to the loss of a childcare system, in addition to the loss of gain of the ability to learn those critical skills that move them forward to the first grade and the second grade. In some cases, they're going to school 2 days a week, and then 3 days a week they're home, and a parent has to be there, or an adult, the child care provider or some other adult, to help them facilitate their learning at home on their tablets or their screens. And we're seeing that, our commission had discussion, as did the Commission on Children and the Commission on Women, about the impacts on the workforce that's having, because one parent needs to be home, or, it's definitely very impactful. So thank you for bringing that to light in both cases.
The conundrum here is that, hearkening back to the data, is that our people in the Latino community are first responders. People in the Latino community are childcare workers. People in the Latino community are critical components of the economic engine of the state. And yet it's almost as if we are telling them, when it comes to the supports that could make you viably participate in that economic engine, childcare, housing security, food security, we're telling them to figure it out on their own. And that's what's always been a conundrum for me. And I think what we are seeing revealed is a foundational problem with the childcare system in the state of Connecticut, that it is so reliant not only on personal income and personal resource, but also where there are those supports, it is so labyrinthine and difficult to access for our families that really, really need it, that it's almost prohibitive to success. So I really appreciate you bringing that to light for us today.
Thank you.
And I just want to highlight in regards to the rental assistance, what I was hearing was that there was a bit of a lack of communication on that rental assistance, and that many communities were really unaware that that assistance existed, or people were also unaware of the governor's executive order, and that is specifically applied to them as well. That they didn't understand that that applied to them as well, and that their landlord had to hold off on those things. But I agree, we have to take some action now to plan for when that executive order expires, or we will be seeing lots of homeless people, which is why our subcommission specifically, chose housing stability as one of our main focuses for this upcoming session. And we have to look at it differently. I think when we chose it, again, housing stability was kind of a different thing than it is right now with COVID happening. So thank you. Next, we will actually be hearing from Fernando Bentoncourt, who is the Executive Director of the San Juan Center. Fernando?
Good evening, buenas noches. Thank you for the invitation. Every time I have the opportunity to respond to the Latino and Puerto Rican Affairs Commission, it's an organization that is near and dear to my heart. So I will always say yes. And I'm honored to participate with such distinguished panelists and administrators and commissioners. So again, thank you for the opportunity. Uh, Knowing that everybody in this presentation knows more on the subject than me, I have decided to take a different route. I prefer to talk about systems change, and I would like to um, try to provide you the information on how these systems affect Latinos and therefore will benefit in terms of not only a pandemic, but only any other subject. When you do public policy development like I have done for more than 30 years, one of the first things that you come across is, first of all, if you look at Ingrid Alvarez's testimony or my testimony in the 1990s in the General Assembly, you will see the continuum of the same disparities, the same issues that still affect our population. So at some point you say, well, yes, it's undeniable that we have made a lot of strides, a lot of progress in many, many areas. However, there's a point that you say, well, but why? Why still we lag or we're behind compared to other groups of the society? So when you identify that, you then study the roots of the problem. And part of the roots of the problem is that when you do public policy, you tend to be reactionary, but not in a negative way. Reactionary because you're forced by the conditions to say, well, the pandemic is here. What do? Do I hide? Do I cover my face, etc.? And then we do not pay too much attention to other systems that are affecting the delivery of the policies that we advocated so many times ago. So let me start with one. The first one is what I call to change the national model in the United States of health delivery to a very decentralized system to a national standard. As you know, when the framers of the Constitution created the Constitution of the United States, they assigned certain responsibilities and what some scholars call rights to the states, and also delineated what are the responsibilities of the federal government, the national government. And one of the things that I have noticed in this whole issue with the pandemic is the extraordinary ineptitude of the federal government and the local governments to respond in a coordinated fashion. And this is very serious. Let me draw a parallel. One of those assigned responsibilities in the Constitution is the national defense. Well, if you were to look at this pandemic as a war, if you are involved in a war and the difference is that the agent that is invading you or attacking you is invisible, you will have to have a coordinated effort to fight your enemy. Well, that is true if this was a war in the traditional conventional sense, but when it comes to health delivery systems, you have witnessed for the last 7 or 8 months states fighting, both Republican governors and Democratic governors fighting with the federal government about the accessibility of resources and how to provide those resources to the population, not only at the state level, but at the local municipal level. I don't have to convince you of the stress that have created in so many states, so many municipalities, how it has disrupted the budget process, the allocation of resources, and how that forces cuts in other areas that also affects Latinos. So what I'm proposing is that instead of having 50 different responses from different states, that we have a national standard, particularly when it comes to how to respond to a pandemic. And I would like that this thinking will only provoke more discussion because I'm just covering in very general terms. The second is what I call support a different redistribution of wealth system. Sometimes this discussion has been hijacked by a particular political ideology. And I believe that it has to do with a misunderstanding of what redistribution of wealth is all about. Every single day of our existence, we are engaged in distributing and redistributing wealth one way or the other. You go to the grocery store, you are providing funds to another entity and you're taking part of your wealth. When you buy or purchase your insurance, you do the same. And you can go line item by line item. Everything that we do is redistributing wealth in one way or the other. So what I am advocating for is that we change the system, the entire system, where the redistribution of wealth more and more improve the quality of life of Latinos. Because when a pandemic or a housing crisis or a tragedy or some other major issue affects you, at least you are in a better position to respond. You have more wealth, you have more savings, and you have more access to actual resources. So I hope that we can discuss that in more detail. But let me suffice to say, every single country or society through mankind's history that have achieved the highest level of improvement in terms of what they provide to the society has gone through a process of redistribution of wealth that have created less disparity as opposed to more. Last recommendation is we don't talk enough, much less in the Latino community, about the investment vis-a-vis the gross domestic product of any society in research and development. For me, this is critical. When you invest more in research and development, you allow your society to be in a better position to respond to calamities. We have learned, particularly Puerto Ricans, if you have seen the response to um, climate change in California with fires, in Puerto Rico with hurricanes and earthquakes, and the list goes on and on. It's almost like patching. You call FEMA and FEMA is inadequate. There's an allocation in Congress, then takes 2 years to fund, and the delivery of funds to the society gets delayed and you suffer. So what I'm proposing is that you invest a much higher, similar to other industrialized countries. For instance, during this pandemic, notice that even if you want to call it a China virus as many times as you want, the issue is that China was able to control the pandemic, but at the same time, through the World Health Organization, they published the genetic code of the virus, which is what the other countries that have developed some kind of vaccines have used to achieve the vaccine. So this is how we have to see everybody connected and interconnected. But if you don't have the funding to do that in the first place, you arrive late. And let me say another thing. This also have an impact on Latinos and our lack of education in all these subjects. Yesterday, the Washington Post published a recent survey that shows that Latinos, 66% of Latinos that responded to the survey, this is a national survey, said that they will be willing to take the vaccine. So that again has a direct impact. If you have a 33% of your own population that does not want to take the vaccine, imagine the contagion that increases in your own local communities. When Representative Candelaria was talking about Thanksgiving, forget about Thanksgiving. Let's look at what's coming, which is the holiday, the Christmas, las Navidades. That's when larger concentrations of Latinos will be communicating and participating with the family. So those three very general policy areas is what I would like to concentrate this discussion on. Thank you.
Thank you very much. And I like the way that you approached the problem. It's fascinating to hear the way that different people think and the way that leaders in our community think. What's most fascinating to me is that when you get so many leaders together and they're bringing information to the table from their own perspective, how it starts to layer into this conversation. I just wish we had, I always wish when we did these things that we had more time, because each person, I have so many things I want to pick at. So hopefully this conversation will continue beyond tonight, because there's just so much wealth of information here that we could be discussing. So I will open it up for questions to Fernando.
You see, I told you, everybody that spoke before me did it right. So there's no need for more questions for me.
Fernando,
Fernando,
I think we're stunned just by the organization of the presentation.
Thought
One of the
process.
things that was so compelling to me was this notion of the distribution and redistribution of wealth. And your description of those avenues, those thoroughfares, you think of the body as an interconnected system of nourishment going throughout the body. Wealth is like that. And how it is that we as a community can access those currents of resource so that they are moving through our communities and energizing our community. It was such a great visual. And it relates to public health, because information is a source of wealth as well, but actual resource as well. So I really appreciate that metaphor, and I know that it'll stimulate conversation among our viewers. Thank you, Fernando.
Thank you. Another interesting thought, Steve, just recently after the election, everybody in the United States discovered that Latinos do not behave electorally the same way. Well, it applies also in terms of wealth acquisition, wealth development, business creation, economic development, and every single area. Not every single Latino nationality or subnationality have achieved higher education at the same rate, and we can go on and on. That is what I mean by that redistribution of wealth. Using the state resources at the federal, state, and local to manage, engineer, if you will, that kind of surplus. If you were to invest, for example, in the infrastructure of this country, can you imagine how many new job opportunities will be presented so the Latinos can be employed everywhere in every single state? So that's just a very minor example.
I think that's a major example. I think it's one of the best examples that I've heard. And that is actually one of the reasons why we focused in on workforce development and education as part of our policy platform, because we absolutely believe as a subcommission that people need to be socioeconomically stable, and they cannot be stable without a reasonable earned income. They have to make enough to afford their family to have a decent life, to have stable housing, to have access to food, secondary education should they want to participate in that, and maybe even the chance to build businesses of their own and develop ideas and lines of revenue of their own. So
access to capital.
So much. There's so much to be said for what you have just put on the table. So thank you so much for bringing that to our attention. And I hope to engage you at another time in a conversation, maybe in more detail on these ideas. Thank you. Next, we actually have the opportunity to hear from the Hispanic Health Council. And this evening we have with us Leticia Morlando and Joanna Cruz. I'm not sure who will go first, but it looks like Leticia's come off mute, so maybe we'll be hearing from her. Thank you, Leticia, for joining us.
I'm going to try to cover. So, some of you already know me and been around for so long. And we are in the core of the Latino community in Hartford, but we actually serve all over the state. We have services all over the state. So I need to echo everything that is being said already by everybody, is that, our experience during the pandemic, like it was said before, is spotlighted exactly what we already knew that our community was already suffering, the social determinants of health that were already impacting our community. So when you talk about the need for rent assistance, the need for utility assistance, food, pay medical bills, and equipment for the children to go into the Google Classroom, and all that is exactly the same that we face. We were fortunate, especially in the peak of the pandemic, to get some funding from different foundations, including the Hispanic Federation, to provide this kind of assistance to the families that we serve. We were able to distribute $115,000 among these families, with an average of the families getting between 500 and 550, either in rent assistance, like I said, utilities, food, medical bills, and even a crib for a baby that just was born and didn't have a crib. But in addition to all these economic needs, we can say we saw an exacerbation in the number of domestic violence cases. You know, they got stuck in this small apartment with the partner and 5 children, and everybody screaming and not having money to pay the rent and not having money to put the food on the table. It exacerbates everybody, irritates everybody, and the number of crises with people that didn't even have, we're not even aware that they were under this domestic violence situation, started to coming out. Fortunately for us, and this is the time that I want to emphasize the value, and because this pandemic has also highlighted the value of the community health workers, because this rapport that the community has with their family home visitor, that they already built it, you know, this trust relationship is makes them to that they are the first line that they call, the first person that they call to say, can you help me? This is happening to me. I don't know what to do. So we have only mental health services in New Haven, but our compliance rate went up with the pandemic because people needed the counselors. And the numbers, when we thought we were not going to get any new referrals, we're getting new cases because of the exacerbation of the domestic violence. Another thing that I want to highlight, when we talk about the, you know, we focus in finding the equipment for the families, you know, finding a way that they get access to the internet, that they can pay that bill, that they can get the support, so they get connected to the Google Classroom. Guess what? Parents didn't know how to do it. So if you don't know how to do it, and you have a first and second grader child, and you are the one that needs to help them to get into that, how are you going to do it? So then the school send packages and instructions and all that. And then the workers call me and says, Leticia, let me tell you what is happening. Families are calling us. We don't know how to read. We don't know how to read. So if they don't know, they may know how to sign their name. They may know how to sign the name of their children, but if they are not able to read a full page of instructions of how they are going to go into the internet, go into the Google Classroom to guide their children, it's not going to happen. And they are so ashamed to share that with the teachers that is not going to happen. So these youth development, community health workers, home visitors that we have are making this bridge to close, are helping these families. Do we have enough of them? We don't. Do we get enough money to actually pay them a rate that, like you just mentioned, you know, they have a good paid job that pay their own bills and their own needs for their own family? Some cases we pay them not the minimum wages, but not enough to cover all their family needs. So it's like we said, it's a whole circle that needs to be breaking in pieces and find a way where we're going to start to addressing this, because we try to say, you know, if we find 4CT, the one that it was mentioned before, the $300 gift card, in a 4 or 5 week period, we serve 110, 120 families That is 30,000 plus in money. But it's a help for them. But what 300 buys for them? What? A week of food, a month of utility bills. So, and they go back to the same. So, and now with the second wave of the pandemic, most of our workforce are Latino too. What we're seeing now is that our workforce is getting infected. So they are the ones supporting the community. And now they are the ones getting infected. And they have their own children. So, and this morning I was talking to our HR person and like, how are we going to do this now? If they get sick, how are we going to address everything that we know is out there? So I don't know, we have to find a way because resources are excellent. But like Betancourt was saying, if we don't go to the root and start working from the root up, this is not going to stop because today is coronavirus and tomorrow could be, I don't know, whatever virus we want to find, because this is something, especially with the change in the environment, with the change in how we eat and what we do, this is not going to get better, unfortunately, at least we do something. So this is, I don't want to reiterate everything that was said before. I just want to summarize that we underscore all the stats that have been presented about the needs in our community. But I want to give you a little bit of another side of needs that we have seen, that is the domestic violence is one, increase on that, increase on the need of services for mental health, increase in the substance abuse, because of all this, you are depressed, you self-medicate, and that's what you do. And then all these needs, when we find out about these families not being able to process what is given to them to provide assistance to the children to be part of the Google Classroom, knowing that especially in Hartford, the district is getting like a 65 to 70% of children not absentee in the Google Classroom. So it's a big issue, and we're working and trying, but we need more resources so we can actually give a hand to our families.
Thank
John?
you, Leticia, for thank you, Leticia, for bringing light to those very important topics. And thank you for bringing up the domestic violence. Our commission did have some discussion on that topic as well. So did the subcommission for women and children as well. I listened in on some of their discussions, and we have been reading those reports on the heightened domestic violence issues. And also we were made aware that you brought so poignantly regarding the parents who don't know how to use the technical equipment. And then when the packets go home, that they struggle. And even if they know how to use the computer, they may not know how to get into the Google folders. And so we have been hearing about the need to increase training for parents that have to work with their children and support their families. I'm going to give Joan a chance to say something and then open the topic up for a very brief discussion, because I would like also to get to Chris Soto, who is on from the Director of Innovations in State Department of Education. So he might be a great person to follow up on some of these comments that have just been made as well. So Joan?
Yes, I just want to close and share a testimony. I had the opportunity to interview some parents that are part of our programs, and let me read this testimony. I translated into English. I should have left it in Spanish, but this is a woman that is a participant in our Comadrona program. She and her husband were working at the same restaurant that closed in March, and both were left without a job. They were unable to support her parents and their teenage son living in Peru, worried that they were unable to support the family as they were doing it before the pandemic. She was pregnant at the time, but she gave birth in June, and this is her testimony. She said to me, look, it was complicated because we are the kind of people that try to help our family. Practically speaking, I'm saying the truth because God is listening to me. I help my parents. I also have a son in Peru whom we have to support as well. We were left with anything when the pandemic arrived, without anything. because we practically sent a little bit of money we had to help my family, and we were left with just a little bit money. Unfortunately, what can I say? We were afflicted. Thank God that we were helped in one way or another with the rent. The council, which helped us as well with the rent and food. It hit us hard because of the pandemic, but we were able to overcome it. Sadly, what can I say? We were very afflicted because they said supposedly it was for 2 months or 1 month, but it was not like that. It was 4 months. It was hard because being left with a little bit of money and not knowing where to go to work, and I was pregnant, and my husband without a job is very complicated. But thank God we were able to get ahead with the little bit we had, and we could. With the help we received from many organizations, we were able to get ahead. He went back to work, and I'm at home taking care of my son for now. But I'm going to be calm because I know there is an income coming home from my husband. But before it was catastrophic. And I left it with that. Thank you.
Thank you. And I just bring to the attention of any viewers that it seems like the common foundation is that our communities are really looking for the opportunity to earn a livable wage so that they're able to support their families and give back to the communities that they live in. And I underscore that with the need for, an expansion of our educational resources to support families in that process so they can gain access to those careers and incomes and opportunities that are all around us. We just need to find the way to connect people to them more appropriately. And with that, I'd like to thank you both for joining us this evening and introduce Chris Soto, the Director of Innovations and Partnership with the State Department of Education. Chris?
Great, thank you, Leticia, and thank you for having me tonight and hosting this conversation. I'm going to share a couple of thoughts, and I do have just one slide to kind of guide the conversation. So I don't know if I'm able to share, but I'll do that in a second. And so, I'm going to share the perspective around education, and I think it's been, shared by others about how all of this stuff is interconnected. All of these issues are interconnected. And I think one thing that COVID has forced us to do is address the interconnectivity of the issues, right? It was easy before COVID to look away and, point to someone else and say, you handle that issue, right? I've got housing, you handle education. I've got education, you handle, the environment. Now we're finally seeing the urgency to address this in a holistic manner. Leticia was talking about, everything that she's dealing with, health workers, maybe helping families navigate a Google folder, right? And so it's all interconnected, and that urgency is ever present now. So I do want to share a slide. I mean, obviously we're talking about the concerns, the challenges. I want to share a little bit of what we've done at the department, but then also talk about the real challenges that face us moving forward. So I'm going to just share, give me 2 seconds. So hopefully you can see the slide. Okay, great. So, no one expected what was going to happen in March, right? And we got through it. It wasn't easy and it wasn't pretty. A lot of hurt, a lot of people's lives getting upended. On the education side, we knew that the fall had to be different because what happened in March was unsustainable. And so, the first thing was to try to attack the digital divide. Before we can even get into, training families with Google folders, we needed to make sure that they had the 3 legs of the stool, which is having a device, having connectivity, and having content. And so we did that through a shared kind of investment, $45 million through the state and $20 million, a little over $20 million through the Dalio Foundation to buy laptops for students who were just not connected with a device. There were a lot of, if a district didn't have a device, some districts didn't have devices, or they had devices that were 5 years old. My dad is an educator, and he would, came back with a laptop that was missing 3 keys, right? That's not how a teacher is going to be able to provide instruction, or the student's going to be able to be engaged. On connectivity, we did an initial survey and kind of understood what those needs were in different communities. Both rural challenges, urban challenges. We have essentially hotspots to 60,000 families throughout the state, and then also invested in some high need and desolate areas as well, working with the service providers. And then the last thing was, okay, so now you have the 2 legs of the stool, devices and connectivity, what kind of content? And so we heard loud and clear that there was a disparity between what remote learning looked like in the spring from district to district. And so we worked with Columbia University to have a model remote learning curriculum for districts that they could, deploy. Obviously, that's not mandatory because each district has their own needs and they're going to do what they think is best for their students and families. But then we also supplemented that with the Connecticut Learning Hub, which is, a plethora of resources for districts when it comes to remote learning. So beyond that, we knew that we needed to understand what districts were doing because of the fluidity of the virus, right? Everything that's happening in schools is dependent on community spread, right? And so that means that if there's increased community spread, one school district could move from in-person to hybrid to remote. And this is why, again, it's so critical that we talk about the interconnectivity. And I'm going to stress a point after about kind of all of our responsibility when it comes to this. And so the learning models, we stood up a data system. So that way, whether it's a family, it's a policymaker, you can go in and see where we are in the state with respect to learning models. And then also attendance. And this is something that I think we're the only state in the nation that's actually tracking attendance on a weekly basis for students. We knew, right now we're roughly at 37% of districts that are remote. There's a percentage, probably roughly the same or a little bit more that are hybrid. And then there are a few districts that have modified in person. So you might have a high school that's hybrid or a high school that's remote, but the elementary school is in person. So there's a lot of fluidity there. And the last thing, we talked a little bit about social emotional learning. That was something that we also recognized very early working, there's a social emotional learning center at Yale University that does a lot of work and research. We worked with them to provide, basically train the trainer for the teachers, right? They can't teach effectively if they're not well, right? And if they also know that their students are not well and they can't recognize the signs, then that's going to be problematic, right? So this training was developed for teachers to, basically understand and react to those signs that they see in their students. So I'll stop sharing this slide and then I'll just briefly talk on a couple of other points. Again, that is the baseline, right? What we did in terms of those investments and the things. I'm not here to say that that's the end. That's quite frankly the beginning. Just like, I love Leticia's example because it's very real, right? When you have a family that's struggling to figure out how to, put their student on the classroom if they've never done it themselves. But the one point that I want to stress, besides all the work that needs to happen, is around the responsibility that we have, right? I'm saying us on this call, I'm saying our friends in the communities. School will, we cannot afford to close schools because of community spread, right? We know that that students learn best for the most part when they're in a school, right? And quite frankly, what we're seeing is that schools in some cases are safer because of the mitigation strategies that happen in schools than when students go back to their communities. And as Juan was saying earlier, they're relaxed, they're around family who they think is safe. And, so mitigation strategies are not happening. And we're seeing the rise in cases due to small family gatherings, right? We haven't seen increased evidence that spread is happening in schools because, again, it's mandatory masks, there's increased hygiene protocols, there's social distancing requirements, there's increased cleaning. And so, again, we need to stress the point that it's not okay for, for us to celebrate Tío Pepe's cumpleaños, because once that student is exposed to somebody, now the teacher's quarantining, the administrator's quarantining, and schools are not closing because of cases. Schools are closing because people are quarantining based on their exposure. And so when a school doesn't have enough teachers to run or enough administrators to run, then the school has to close. And so, again, these issues are all interconnected. We know that through the documented contact tracing that where we're seeing community spread through the family gatherings. And for young people, it's actually through unsanctioned sports. So we have to come to terms with what is really important to us, right? Don't get me wrong. We need more investments in everything that we talked about. Housing, healthcare, education, without a doubt. We know that COVID has, fractured the cracks that we could see, and it's exposed the cracks that were invisible, no doubt. But at the same time, we need to really figure out and communicate what is really important to us, because we don't want to have those challenges that we talked about, right? In terms of remote learning and the challenges that parents are facing, when we know that there are strategies that we can employ to stop community spread. So I'll kind of leave it there, and I'm happy to take any questions on the education front.
Thank you, Chris. Very well said. And the slide was also very helpful, I think, for me personally, to understand the investments that were made in digital support and things of that nature. I will allow other people to ask questions before I pose any questions of my own. Does anyone, even please feel free, speakers, also to engage in the dialogue. Certainly, we would like to have a rich dialogue. And Chris was the last presenter for the evening, so feel free to pose your questions at this time. Hilda, I don't know if you're speaking, but you're on mute.
Okay, can you hear me now? Okay. My question to Chris has to do, as he was talking about our students not being able to connect, their parents don't understand, don't have the wherewithal, the knowledge, the understanding. I certainly see that there's certainly some communication issues in terms of language barriers. But one of the questions that that came up for me, one of the thoughts was, to what extent are they engaging paraprofessionals to have some better outreach to the children, to the kids as students? And what are IT folks from the educational systems, are they being engaged to try to facilitate connections and a greater understanding of how to navigate technology for parents that can't read, can't write, don't understand the language, and perhaps maybe employ individuals that have the capacity to speak other languages in IT areas so that they can further reach a lot of the students and the parents in our communities to begin to extend education beyond the walls of schools.
No, that's a great question. And so, as most I think are familiar, we're a local control state. So, what could be happening in New London is different than what's happening in Hartford. We have about 200 districts. But what we are finding, I think, to answer your question, is the districts that are doing the best with community engagement are the ones that have representation of their communities, right? And, again, we talk about, interconnectedness. Who would think that teacher diversity is so important, or administrative diversity is so important now when we talk about the pandemic, right? And so, again, these districts that we're hearing are, have some innovative ideas or are doing things proactively. It makes sense because they have good representation from communities of color. They have administrators of color, bilingual educators, bilingual administrators, and they're doing things that make sense, right? Obviously, it's tough, and they're not getting it right all the time, right? We are in a global pandemic, but I'll give you New London's example. I literally was driving in the community and saw the gentleman who the district has hired knocking on doors, for that 5% or whatever percent it is of students that they just cannot get to connect in classrooms. We have, community workers that are literally knocking on doors hired by the district, right? because it's not enough just to send out an email. It's not enough to just, put something on a community board, right? You literally have to get into these homes and see what's going on. So again, I would just bring the point back to representation, and I think it underscores the need for representation in our districts, and we're seeing better outcomes and better strategies employed by those that do have better representation.
If I could, I'm sorry, I saw Lisa's hand and I was looking for my hand button.
Sure, Wildelise and then Ingrid. Thank you.
Thank you.
Okay. Thank you so much for that presentation. My question is, now that districts are going, some of them are going hybrid, with parents having to work as essential workers, some parents are placing their children in childcare places, childcare family centers, etc. And so what kind of supports are available to those childcare centers that are now receiving, for many of them, the first time, children who are older, who need to plug in when they need to plug in virtually?
Right. Yeah, so that's a good question. That's another thing that we worked on a few months ago, was maybe not specifically to the child care providers, but one thing that we realized was that municipalities were setting up basically learning pods, right? So we saw this early on where affluent families were going to set up their own learning pods. And then, municipalities basically realized, and mainly through their rec departments, that they were going to have to set up learning pods for these older students, exactly who you talk about, who have very different needs than, toddlers or 4-year-olds or babies. And so again, I can just give you an example here in New London. So the rec department essentially set up these learning pods, hired community workers that works with young people to make sure that they're getting logged in. Things like, and setting these pods up to have extra chargers, to have extra, 1 or 2 extra laptops, because if a student comes and they ran out of the door and they forgot the charger, what we were finding was that their computer was dead and they literally couldn't log in. And so I will say that to the funding piece, so the coronavirus relief funds that came from the feds, that is an actual allowable expense for municipalities to use for their childcare, which is why we went down this road to try to connect the dots on childcare, mainly for the older students that had needs. And when I say older, I'm not talking about high school. It's like that sweet spot of like 5 years old to about 13, right? So students, 5 to 12 who couldn't stay home alone, right? And they weren't the high school students and they weren't the younger children in childcare centers, but they needed some type of support to get logged into their classes. So I would encourage you to check, what the municipality is doing around childcare, working with the school district and the municipality. And if they're not, I'm happy to have an offline conversation.
Thank you. That was very important. I think I'll connect with you because I have some interest in that for my municipality. We don't have a learning pod here in Windsor. Ingrid, you had something that you wanted to contribute.
Yeah, I think so. So it's like, for me, it's like a mashup of Fernando's contributions around just redistribution of wealth, right? And then acknowledging the language that Chris so very eloquently shared, because language matters, right? So it isn't an issue of underrepresentation. It's an issue of exclusion, an exclusion of specific geographic regions, Black and Brown communities, right? It is an issue of disempowerment. It is an issue of if our state's fiscal and colorblind neutral public policies, right, continue to be sustained by the civic engagement investments that we are or we are not making, right, when we elect and have people represent us in the Connecticut General Assembly, right? It is that interconnectivity, thanks Chris for that word, right? It is this very fine, delicate balance of an ecosystem, and it is all interconnected. And then I'm gonna give Chris kudos. I'm like, Chris, I think you need to create a glossary of analogies with some of that language that you shared, because it does absolutely matter. And so if the budget is a state's primordial indicator of what it values by making investments than our communities of color, our people of color-led community CBOs, community-based organizations, our investment in the gig economy, in which our people support every main street in all 169 cities and towns of our state, right? If we are continued to be called non-essential within the fiscal priorities, coupled with the sustaining of colorblind neutral public policies, and I'll define that if I need to, both for the audience or anyone here on the panel with me, because we're a state, again, historically entrenched in some of the most pervasive disparities across every economic indicator we can call out: education, workforce development, the housing burden, education. And so ultimately, I wanted to thank both gentlemen, because I think that we throw a lot of jargon around in our spaces and our fields, but really what we're talking about is dismantling racism. What we're really talking about is also investing, right, in the backbone technical assistance, both from the community organizing perspectives on where the rubber meets the road in our streets, to the capacity building of our nonprofits. And I know that there's a lot of debate, and depending on how somebody sits on the spectrum, people act like, we're just, we're giving handouts to CBOs, right? There's a capacity building paradox, and that there's a level of expertise, technical assistance, and capacity to lead this work. Except that in our state, this work isn't led by people that look like us sitting here in this discussion at all. And data is crucial, right? Because if we're not disaggregating data across education, health, Wildalis, your childcare, I'm a working mom, I have always been in my life. It is without childcare. When we talk about those statistics I shared early on, right? Black and brown female single-headed households, overwhelmingly. We need a place for those babies, right? And whether they're 5 to 21 plus, right? Sometimes. And so Latinos right now at this juncture, but also the Asian and Pacific American community, the African American community, are intrinsically tied to the economic recovery, because we're not even at prosperity. Before the pandemic hit, right? We were doing a lot of talk about recovery and investment in our state's economic recovery, and we're not underrepresented. We have been excluded, and in some cases that has been intentional. In other cases, it's been sustained by people because they don't share in our experiences, because they don't understand how these policies impact us, then it's not a problem. And therefore, as long as we don't disaggregate data in this state, as long as we don't collectively commit to that common language, and in every single space, at every single time, it is, correct it, call it out, right? It's this perpetual cycle of, recommendations, shared ideas, but back to what Fernando said, it is an issue of redistribution of wealth. And that redistribution of wealth will not happen for Latinos or any other community of color in the state without racial and ethnic impact statements. And the people that look like us, that know how to raise them, conduct them, and see them through. Because one thing is this, the other thing is to execute. But that costs money, and it requires resources and investment. And that's where that collective voice, and I think it was Representative Candelaria, right? It's about that coalition building. And it's about that commitment, right, to doing that due diligence in that work, because it's not easy work, especially when there's a huge learning curve, even for the content experts like us, who are tasked in these spaces to break this down in the colloquialism that our people live in every day. I think about my mother and how my mother receives information. I think about my sister, who's only a year and a half different, and has nothing to do in the spaces like that I've grown up in professionally. And to lay people on top of what Leticia so eloquently, you sounded like my mother, Leticia, shout out to you, because those are real, where the rubber meets the road and how our people live in our communities. So thank you, everybody, because I think that, you know, for me, language is so critically important, and each one of you gave me some, I was sitting here like this, gave me some new language, and I'm hoping that, you know, Executive Director Hernandez and commissioners, that you'll share a transcript or a lot of the resources and the collective recommendations shared here, because that's how we start to work together, right? That's the shared agenda. And then teaching one another and that shared learning amongst us, regardless of what region, which town out of the 169 cities and towns in our state we're in, right? That it goes back to that interconnectivity. And more importantly, so today, under this unprecedented time, we're headed into a legislature that for the first time in our history may be virtual. You know, how do our people engage? Thank you.
Thank you.
Can I just add a comment to what Ingrid also said? I just want to punctuate her impassioned commentary and what I took as a speech, but how critically important it is for Latinos to be at that table where it counts, and that's where the rubber meets the road, so that you have a voice right from the onset. Ask the community what the issues are.
Thank you, Hilda. And I think it also frames the conversations that Gladys, you, myself, and Werner have been having, which, I mean, it's fascinating, and it's actually reassuring to hear everyone's input being in line with the policy platform that we've laid out, because that is the point of having a listening moment, is to say, you know, is what we're thinking the communities are needing, is that being represented in the policies that we're pushing for? And I have to say, I feel very proud and glad that, you know, the commissioners that I'm working with on my subcommission brought so many of these issues to the table in our discussions, and that Werner so eloquently put this panel together to inform us even further at a deeper level on these issues. And I do want to go back to something that Fernando said, and it also ties into something Chris said, and really something that each of you said at one point during the conversation this evening, and that my subcommissioners have said on every meeting that we've had. And it really is that all things are connected. And at the end of the day, it really does matter who is at the table. And I bring this point forward very specifically because we've been having really detailed conversations about breaking out data and knowing who is part of the planning that is occurring in our state, because oftentimes there are plans that are written and then brought to us and presented for feedback. And but the plan's already created. And so we're giving feedback on something that is really going to be rolled out anyways. And what happens when that occurs is there really is no opportunity for true dialogue and inclusion. And I think that goes back to Ingrid's point, is that sometimes we're excluded purposefully, and sometimes it's accidental exclusion just based on perspective. And I'm going to give a specific example of that. So I had the glory and honor of participating in the governor's transition team, and I was assigned as a co-chair of the energy arm of that. And during those discussions, I kept bringing up the affordability gap on energy, and I kept bringing forward data from the OCC that over 400,000 households in Connecticut literally can't keep their lights on. And this was shocking to everyone else on the commission. I was one of 2 people of color on the commission of like 30 people, and the other person happened to be the head of Operation Fuel. So she definitely was aware of the affordability gap. So at least I had a friend on my commission. But this is so common in the rooms that I have, been introduced to more recently. I'm a younger person when it comes to policy, and I maybe not as mature or as ingrained in the technical information as some of the others that are represented on this, Brady Bunch screen. But one thing that I have come to learn is that if you're not represented in the initial conversation during the planning and budgeting phases, there really isn't much that can be done afterwards. You're just fighting an uphill battle. And honestly, I really feel strongly that when Fernando so eloquently discussed the systemic issues, the long-standing systemic issues, which are so often the core of what our subcommission is discussing, it really does come back to the data. And to my understanding, we really haven't had a disparity study in Connecticut for over 20 years. And I think that has to do with the lack of budgeting funding for that study. And Ingrid kind of pointed out that that study really needs to be done by people who look like us, represent communities of color, so that that data is collected in a way that's effective and really representative of the issues that these populations are experiencing. And so maybe, I know it's always so hard, there are so many issues to tackle, and I couldn't write fast enough either. I think that at the end of the day, we do really need to focus in with our, sister and brother communities. And we've done some work. Recently, we had a subcommission meeting of the different commissions represented on the Commission for Women, Children, Seniors, Equity, and Opportunity. And that discussion really included some in-depth consideration of the metrics that we're using to quantify where the disparities are. Because sometimes these reports make it seem as though supports were provided to a community, but it's because some of these metrics include groups that are already getting supports anyways. And so we do need to kind of sharpen our pencils and dig down to the level of where are the issues, where do we need the supports, where does the money live now, and how can we redistribute it in a way that would most effectively support the groups that have been historically left behind. I would say that
I would like to say a couple of things about that. I think that you are point on. The first step is to be visible and to be present. And we have to demand that presence. The second thing that I would like to, I don't know how to say it. It's like I believe that the power of our collective wisdom and intelligence, which keeps increasing by leaps and bounds. The resources that we have are so many. Leaders that we can bring on every single subject or area, any field. But we have to convey that message with being humble and also not talking in hyperbole. Let me give you one very quick example. People in this pandemic are talking as if this is the end of the world. And I understand why, because it's in our face, it's affecting our family members, our friends. But in 1918, there was another pandemic worldwide that affected more people than we have today, with less resources, when many of the same countries were ending a worldwide war, the First World War. And if you look into the recession afterwards that called into the depression in 1928, and you see those long, long lines of individuals who had nothing and they were looking for some food, compare those same lines now that are interminable and there's an absolute need, but on SUV, sedans, compact cars. I mean, there's what I'm trying to say is let's put everything in context. Let's try to bring a historical perspective. Why? Because when you do that, people will understand and will respect more your point of view. Because for too long, our point of views and advocacy has been viewed as, oh, they are asking for a handout. Oh, they're asking for more. It's a favor. No, 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 no. Esto no es una dádiva. And to use the word of Stephen, the conundrum is how to explain these public policy issues that are very complex in simple terms, not for public makers, not for elected officials, for our own community. And that's the difficulty. Like, for example, the issue that I mentioned before about distribution of wealth. When you distribute wealth, you know what happens? You create more wealth. It's not the opposite. The only difference is that it's not concentrated on a few. So I wanted to say that for further discussion.
Thank you for adding to that discussion and for clarifying your point on wealth distribution as well, because so many people do misunderstand that concept, that it really is generating opportunities to engage in developing more wealth continually. So I just want to thank everybody for the incredible contributions that they have given here tonight. Really, and Leticia the other Leticia and Joan, thank you for bringing the points right down to the people. I think that it is, sometimes as policymakers and as leaders and commissioners, it's so important that we hear those real stories about what is actually happening in the community, because I think that is where we get inspired and become passionate and really feel empowered and really almost required to take action and push forward on these most critical issues. I want to thank Werner for putting this panel together so gracefully. It's like he's so magical, and the way that he makes things happen, I just can't tell people enough. Thank you to my subcommission members who really helped to develop this policy platform and champion these issues and drive home these points every day in their communities, but also to keep our work in line. And as we continue forward with this work, which will literally never end, I just remind you that it is so important that we work together with the other communities of color, because by all means, while this is heavily impacting Latino communities, it is certainly impacting other communities of color. And we ultimately, as Chris eloquently noted, are all connected at the end of the day. And I just want to say one more thing, really in honor of my father, is that, we talk a lot about problems and we talk a lot about solutions. And I have heard the words community of color and equity connected like 50 times in a day on every call and webinar I'm on. But saying the words community of color and equity in the same sentence is not the same as creating equity for communities of color. And I think that is so important as we speak with policymakers that don't reside in communities of color, maybe don't hear from communities of color, that live in areas where they're not understanding the experiences that these groups are having, that just repeatedly saying communities of color and equity is not changing anything for those communities. And in order to make those changes, we have to have a strategic plan, measurable metrics, and the will to move forward. Because in all honesty, I do not feel it is a lack of funding or a lack of resources that have held these communities back, forever. It is a lack of willpower to redistribute that wealth, as we've discussed a little bit here today. And so we saw the tip of the iceberg on that one. And it's also the redistribution of power, not just wealth. That seat at the table is the equivalent of power because it offers the opportunity to express one's issues, concerns, and ideas, and bring forward things from their communities that they may be representing for those who maybe can't speak for themselves, don't have the time to go there, or many other barriers that we all know in this work exist. I want to thank our executive director, Stephen Hernandez, for always having an eloquent voice and contributing to the conversation and carrying it along when I'm at a loss for words. And with that, I open it up for anyone else who has anything they'd like to say in closing. Thank you so much for joining us here today.
Thank you, Leticia. As we come upon the close of the hour, I want to thank you for your masterful guidance throughout this conversation and really helping the flow of this conversation, this really important information that we've received from each of our esteemed panelists. I can only imagine what it's like this moment in our history for the status quo, because what the Latino community is now showing is its collective might, how it is that we are coming to the table, how it is that we are inserting ourselves into these important conversations, because really what we are disrupting are two critical types of elitism that we have been under for generations now. The elitism of exclusion and the elitism of I know what you need. And those two types of elitism are what has kept us from the table. And what's remarkable about this moment in time is not only that we are disproportionately affected by this pandemic and the social injustices that we are seeing in this country, but that we are also disproportionately stepping to the table and demanding our voice be heard and that we be participants in the systems that are actually going to improve life for all of us. So this has been an expression of that. I thank you so much for your generosity of your time and the generosity of the Latino community as a community that always gives back. And I just want to close by thanking you, Joan, for that powerful story of that family, because the family that you described is the embodiment of what we are as a community. We are strong. We work across generation. We lift each other up. And at the end of the day, we figure it out. So thank you so much to each of you. And let's continue this conversation. Hasta pronto.